probably advise the student to first think about what their career goals are. They might be interested in primarily doing clinical health psychology related work. They might be interested in doing health psychology research. Perhaps they want to do some combination of both. So I think the direction they head will be somewhat dependent on what their future goals are. So for example, we work, at my institution, we work with a lot of students who are, they've received exceptional clinical training and come from PsyD programs, and at the graduate level, they probably come out better prepared than many of the students we work with, the interns and fellows we work with, who have come from PhD programs in their clinical preparation. That being said, there are some very exceptional clinical PhD programs where students get an array of clinical health psychology experiences, but I don't necessarily think that should be what students target, because I think a lot of the specialty training that individuals can receive in health psychology can happen at the internship level. It can also happen at the postdoctoral level. But if students, whether they want to pursue a clinical career or a primarily research career, they're probably going to want to look towards a PhD program, and these tend to be across the board a little bit more competitive. They will often pay for one's tuition and provide a nominal stipend, a living stipend. And so these programs tend to be highly competitive. And if those are the types of programs that someone wants to go into, I really try to encourage them to think about what type of preparation they would need at an undergraduate and potentially post-baccalaureate level to make themselves competitive for those programs.
For that, I would find out what the students are doing after they leave. So if you're someone who wants to go in academia, and you look up the stats on a program, and because they usually have them posted on their website and everyone's going clinical, this may not be the program for you. If you want to go clinical and everyone's going academic, that may not be a good fit. I'd also think about the research mentors that you're going to be working with. So talking to their current students to see how they're feeling, how they're doing. You can tell how stressed or non-stressed grad students are, and you will be stressed out, but you want to find a place where they look stressed but also happy about what they're doing still. So that may be a good fit. Thinking about location, for graduate school, you're likely going to have to move somewhere that may not be where you would usually pick. A lot of the really strong programs are in different places, so you may be moving farther away from home, because for graduate school training, you're looking for professors and programs, not necessarily the school. While in undergrad, you're maybe looking for a big name, the big football team and all of those things. For graduate students, for graduate training, you're moving for a particular professor in a particular lab. And this just may be 4 or 5 or 6 years where you're living somewhere different than you intend, but this is a place for you to get the skills you need to do things later. I'd also think about if you have particular populations you'd like to work with, making sure they're available in the place that you plan to do your graduate school training.
I think the #1 most important thing is fit. So they need to think about, of course, whether they want a PhD or a PsyD. I tend to recommend more that people go for a PhD. I think that there's more flexibility with that particular degree, because people sometimes change their minds and they might fall in love with research, for example, and there are more opportunities in that way with a PhD. I think that they need to read carefully up on the different programs. Students often don't realize how many differences there are between different programs, that not only are some much more clinically oriented, others more research oriented. Some have special tracks like health psychology tracks, for example. And so I always recommend that they do a lot of online reading. And then of course there are the books that APA puts out about graduate study in psychology that have valuable information about the different programs. So the #1 thing is fit. If they can think about what they're specifically looking for, does that program offer it? I think secondarily, geography can be important too, because some people really feel very wedded to one part of the country or another, and it's easier to get an internship in the same general area where you've gone to grad school. Although I have to say at my university, students successfully go all over the country. So I don't think that's as important as something like fit.
For a graduate program, if they're interested in applying health psychology in some way, that means they want to work directly with people with chronic disease, for example, in a hospital setting, then sometimes there are options for them that are more applied and not so much research-oriented. And so they might be interested, for example, in an MSW that specializes in medical settings. And so again, I ask more questions. But if they are interested in health psychology and they are interested, maybe they don't know so much about research in health psychology yet, I talk with them about that because I really believe that health psychology, the foundation is science of health psychology. And so I talk to them about getting involved in research, seeing if it's something that they do, that they are attracted to. So I really encourage them to get a lot of research experience. I also encourage them to get some applied experience if they're interested in application. So for example, volunteering in a hospital setting. And then in terms of choosing a graduate program, there are a number of very good graduate programs now, in PhD level programs in health psychology, clinical health psychology, social health psychology. One of the very cool things about health psychology is that it's integrated often with many of what we think of as the more basic psychology disciplines. So they might be interested in social health, clinical health, or neuroscience. And so then we get to even more specific questions, and I try to recommend programs tailored to what they're interested in.